Welcome to Monza. My name is Giacomo Bellani. I am Associate Professor of Anesthesia and Critical Care Medicine at the University of Milan Bicocca and Staff Physician in the General ICU of the San Gerardo Hospital here in Monza. My clinical and research focus is mainly based on mechanical ventilation, monitoring and ARDS. Mechanical ventilation is a very powerful tool, of course, that saves the lives of many of our patients. At the same time, mechanical ventilation can also cause harm. And it is, of course, important to derive as many parameters as possible from the mechanical ventilator and use them to set the ventilator in the most effective way. It is also important to understand what news are published in the study and how to apply those very important concepts at 3 o'clock in the morning when you admit a patient in the ICU. So for me, as I said, monitoring is really crucial. Setting mechanical ventilation and monitoring are two concepts that always should go together. So at first I try to have a phase in which I assess completely respiratory mechanics of my patient and understand more about her or his disease and how to set mechanical ventilator. And then I always try to measure again these parameters after something in the patient condition or in the ventilatory setting have been changed. And also we try to keep together the information that we derive from the lab, from the ABG, from the imaging and from the mechanical ventilator. The idea of the lecture is to provide an update on the recent and maybe less recent important concepts that have been published in regard to safe mechanical ventilation, but not just recall the concept and the physiological background, but also show practical application of this concept. And it is also important to understand that we can get many information already from our ventilators, and so we should be able to do the best use of this information to safely and effectively ventilate our patients.